Okay, welcome everyone. This is Dr. Edward Kondrot, and this is Ask Dr. Kondrot a Question. So before we begin, I would like to show everyone a video, if that's okay.
Good afternoon, listeners. Welcome to our popular program, and we have a special guest from Oshakati State Hospital.
Thank you, Mendeshi. My name is Ndeshi Shikulo. I am here to tell our people we are going to have an eye camp at Oshakati State Hospital. We are here to invite all the elder people or everybody who is at home that is not seeing to come and see us at the eye clinic. So we are telling all of our listeners that we have got 1 month for you to come to the hospital for your screening, to be operated during our eye camp. If you are seeing a person around you who is not seeing, please bring them to the hospital. Bring your uncle, bring your grandmother, bring everybody to come. This is your chance to see again.
My name is Dr. Helena Ndume. I do have a middle name, which is traditional name, which is Ndaipovano. It means I am better off. I was born during the apartheid system, where the education was different for the black people and white people, where young people were demonstrating and scared to be arrested, to be put in prison. They decide to leave the country. We left the country with 3 of my friends, and we managed to sneak over the border into Angola. In Angola, there was civil war, bombings and killings, camps being attacked in the middle of the night while we are sleeping. You are hearing bullets flying all over your head, corpses all over the place. And mind you, I was 15 years old. We crossed into Zambia. I ended up in the refugee camps where we built hospitals, we built our own schools, we built our barracks where we were going to stay, and we started going to school there. We have mathematics, history, geography, English, and all that. It was completely eye-opening. I ended up going to university in Leipzig, Germany, to start medicine. When independence came to Namibia, I came back home. I started my internship. I was the only ophthalmologist working for the state. You have to know that back then, it is a belief that when you are old, you go blind, and that is God's willing. Nothing can be done about it. When I started the eye camp, just 82 patients came because they say, if you go there, that young girl is going to destroy your eyes. But then the 82 that we operated on spread the message like wildfire. The following year, we couldn't control the crowds. They came in their thousands. Everybody now wanted to be operated on. They said that independence have really come. We have doctors, and now we can see. You cannot just be in the private practice, making money, knowing very well there are thousands who are blind and they need help. And you cannot call yourself a developed country if you have people getting blind from cataract today. No money in this world can pay for the happiness of someone who was blind. And suddenly you take off that iPad, then they said, "Doctor, I can see." If I have to tell you the story that they tell you after they regain their sight, we'll spend the whole night here. Doctor, now that I can see, I'm going to work hard and plow a lot of food. Doctor, now that I can see, I'm going to see my grandchildren that I haven't seen for 5-6 years. Or a mother who had given birth and she never saw her baby came to see the child after cataract surgery. All of us went through difficult times during the liberation struggle in the refugee camps, and that is also what connected us together, that we must go back and help just like we were helped. We have to have a culture of giving back to less fortunate people so that they can also be transformed just like I was transformed.
As many of you know, that I was actively involved with mission work prior to COVID. And I recently had an opportunity. I was requested to become the surgical eye director of an organization called sight.org. And if you're interested in taking a look at some of the medical missions I did in the past, you can go to missiontocureblindness.com. And on that site, we have a listing of the missions my wife and I did prior to COVID. And we were doing maybe 2 missions a month at that time. Now I'm scheduled, sight.org operates in Africa. And in October, I'm going to be going to Madagascar to meet with a group of doctors who have some equipment. And we're going to be moving that equipment to Togo, Africa, which is on the West Coast. And we're going to be establishing a center there for surgery and also for training doctors. So this is a very exciting opportunity for me, but I do want to make it clear that I'm not abandoning you as patients. I'm still going to be running my practice, and because I'm able to do this virtually online, I can be anywhere in the world and still communicate with you folks. So I hope you can help me with my mission work. Sight.org is a nonprofit organization, and we're always looking for people that who may want to help on this wonderful cause. And if you go to their website, sight.org, and click Give Sight Today right here, there's a little donation page right here. And if you could type in the note, Dr. Kondrot's mission, and this will, 100% of the donations are going to help the blind people in Africa. My apologies that you couldn't see the video, but I'll send all of you a clip of the video after we're done with this meeting. Okay. So let me open it up for questions. And the way the questions work, you can either raise your hand. There's a little app down below, raise your hand, or you can also type the question in the chat. So there's a chat place. You can raise your hand. Let me just see here. I think there's a little app down below. Raise your hand. I can't find out where that is. Let me see. Okay, we got one question here. Can you say if EDTA should be sodium or calcium EDTA? That depends on your alternative doctor. There are two types of EDTA, sodium and calcium, and that should be something you consult with your doctor. We do have EDTA capsules and detoxamine, and I believe that is calcium EDTA. On one hand, I want to make it clear that the EDTA doesn't actually treat the cataract. I don't want you to have a misconception that by getting chelation therapy, it's going to reverse the cataracts. What the EDTA does, it removes the lead and heavy metals, which might be a cause for the cataracts. So I believe that the big underlying cause for cataracts, and as a matter of fact, I see this when I do mission work in Africa. I see young people, teenagers and people in their 20s that have advanced cataracts and they're totally blind. And I think this is entirely due to nutrition. A big culprit is the lack of vitamin C, and also the poisons in our diet, in particular salt and sugar. So those of you that do have cataracts, the first thing that I would recommend is really looking at your diet and the food you're consuming. There are some alternative doctors that feel that cataracts are what they call a focal form of vitamin C. And what I mean by focal vitamin or focal scurvy, they think it's a focal scurvy. Scurvy is very rare in the United States, mainly because we're getting enough vitamin C to prevent scurvy. But when we're under stress, our body needs more vitamin C. We're not getting enough of that. And focal scurvy is manifested by cataracts, macular degeneration, periodontal disease, heart disease, many, many chronic conditions. So one thing I advise all my patients that have cataracts is to increase your consumption of vitamin C, and also look at your diet and look at methods of detoxing. And the EDTA chelation is wonderful for detoxing. It removes the heavy metals that may be an underlying cause. And also we have a product called Occlumed. Occlumed is an eye drop that has some ascorbic acid or vitamin C, and also a precursor to glutathione. Studies have shown that when you do develop a cataract, you have a decreased level in ascorbic acid and glutathione in the fluid around your eyes. All right. So I'm sorry about the video, but I will send you a link. Okay, there's a question here. Polypoidal choroidal vasculopathy as age-related macular degeneration. Well, there are many, many different names for macular degeneration. There's probably a list of about 50 or 60. What I usually do is when I review a patient's records, I want to know if it is the age-related form or if it's some type of dystrophy or a hereditary form of macular degeneration. Most cases of macular degeneration are not hereditary. I think they're age-related, but more importantly, I think they are related to diet and nutrition. I have something very shocking that I want to share with you. Macular degeneration did not exist before 1920. When I was doing research for my book, Homeopathic Ophthalmology, I studied the ophthalmic literature from 1850 to 1910, 1920. Ophthalmologists had devices to look inside their eye. Macular degeneration did not exist. That's It's like shocking. You mean people weren't getting old? You mean there wasn't pollution at that time? There was plenty of pollution in the early 1900s. The problem is changes in our diet. In 1910, 1920, I think it was 1920, margarine was introduced in Crisco. We began consuming polyunsaturated fats, vegetable oils, corn oil, canola oil, and all these things in our diet. There's a brilliant researcher, Dr. Chris Kenobi, who I'm hoping to do a podcast with, who he studied this. So I think that our diet is a big, big contributing factor to macular degeneration. I see Jean there. You have your hand raised. I'm going to be unmuting you. Jean? You have to unmute yourself. Then I can hear you. Yeah, click the unmute button.
Did I do it now?
Yep, I hear you now. Great.
Okay, thank you. One of my questions would be, have you ever heard of urine therapy or urine therapy?
Yes, I have heard of urine therapy. I'm
Okay,
not really an advocate of it.
Okay. Oh, you're not an advocate of it.
Well, I
Can
don't
I
know
ask-
much about it.
I'm sorry?
I really don't know much about it, but I have heard of urine therapy, and I know of doctors that use it. In fact, some of them use it in a homeopathic manner. They feel that the urine has certain ingredients that homeopathically can treat your body.
Correct. I've been on it for about almost a year now, and I have several health things that have been corrected. My blood pressure is normalized now, which was not. My rashes on my legs that have gone away. Hemorrhoids, great for hemorrhoids. I have another whole list that I can send you. I would like to get together with you anyway later on.
Yeah, send me the information on the urine therapy.
And as far as information from I have an optometrist who I've been going to lately, who we are going to get some tests done next week. And then I would like to have you review those after that happens.
Yeah, contact the office, and I'd love to take a look at the records. You know, I don't have all the answers, and I probably learn more from my patients than I do from medical meetings. And so I'd be interested in the urine therapy, but I used to be president of the Arizona Homeopathic Integrated Medical Association in Arizona, and there were a few doctors there doing urine therapy, but I really never thought much of it at that time.
Okay. I found out about it through a Dr. Group, who is a chiropractor here in Houston. And he's very, very high on it. Matter of fact, he does a similar thing that you do, like here today. He did that last Thursday, where we had a bunch of people on and he would spend time talking with us. It's really great. We really appreciate it. The other thing that I got from you was ozone therapy. But I'm floundering. That hopefully we can get together when you see my records. And
ask them about the ozone drops drying your eyes.
Well, let me just comment a little bit about ozone. I think, and I do have a couple of YouTube videos. I've interviewed Dr. Frank Schallenberger and Dr. Robert Rowan, who are the two leading authorities on ozone in the United States. Ozone eye drops are wonderful for dry eyes and inflammation. But I'm a big advocate of rectal insufflation and auricular.
okay.
Both of those methods can reverse eye disease.
Okay. We have a PromoLife generator that I've used to do the rectal. I got away from it for a while. I started doing the ears, and I thought the ears were going to be better because they were closer to the optic nerve. But then I wound up, I think I was using too much gamma. So I've got.
Yeah, you have to be careful. You have to be careful with the ears because it can cause a lot of irritation. And
Yeah.
ozone gas is very toxic if you can breathe it. So you want to make sure you have a good ventilation in your room.
Right. Yes. Anyway, so that's all I have.
Okay, I'll look forward to talking to you in the future. Thanks.
You're welcome.
Okay, the best way is if you do have a question to raise your hand, like Jean did, so I can talk to you. But I'll be looking here at some of the questions here. Oh, yeah, I will be sending you a replay of this webinar along with the video. I really wanted to share that video with you because it's about the wonderful work that's being done through the different mission organizations that I belong to. Ozone. Ozone does not work that well for cataracts. It's a very good treatment for macular degeneration and glaucoma, but not very well with the cataracts. Let me see here. Okay. Other questions? Oh, there's a question here about macular edema due to cataract surgery. And unfortunately, that's a very common problem. I would say a common problem, but it can occur after cataract surgery because of the trauma with the surgery. You get some macular edema or swelling. It's like whenever you have any other surgical operation, you may get edema or swelling. So one thing we have to do, and the question is here related to the autonomic nervous system. And I do think that whenever you do have any inflammation or edema in your body, you have to quiet the autonomic nervous system. And one way of doing that is, deep breathing, meditation, positive affirmations. I have found that microcurrent and light therapy can help very, very much with reducing the swelling in the eye, especially light therapy. Light therapy helps to balance the autonomic nervous system and can reduce inflammation. Generally, I don't like some of the treatments that eye doctors use, like steroids. Steroids can help, but they have a lot of complications, long-term complications. Here's a question here. Does the eye tears have microbiome? Also, the gut microbiome have any effect on eye health? And I'm a big believer that the health of your gut is very important for the health of your eyes. And the tears do not have a microbiome, but the tears are actually bacteriostatic. They prevent bacteria from growing on your eyelashes. And one of the biggest problems that people have when they have dry eyes, they have a decrease in their tear secretion, and a decrease in tear secretion enable bacteria, unhealthy bacteria, to grow on your eyelashes. And that can cause a problem with worsening of the dry eyes and more irritation. So one thing that I do recommend, or I do like for people that have dry eyes, is the ozone eye drops. A question here, would red light glasses be suitable for wet macular degeneration? And I really can't answer that because I'd have to take a look at your eye records. And for those of you that may have not sent your eye records to me, you can go to Free Consult. That's FREE consult.us. And you can send me a copy of your records and I can look at it, because there's many different types of macular degeneration, in particular wet macular degeneration. And what I'd want to do is to see what type you have. Red light glasses might be harmful because the red light spectrum is putting more energy into the eye. Generally speaking, when I see somebody with wet macular degeneration or inflammation or swelling, we want to do a light therapy to reduce that swelling. And we want to use more towards the blue spectrum. But there's a whole nother type of light therapy called red infrared, which is a little bit different than red light therapy. This is an energy that may help reduce the swelling. So I really can't comment. I'd be a little cautious in using just red light for wet macular degeneration. Question here, does acupuncture rid glaucoma? And how about hyperbaric oxygen therapy? Acupuncture will not rid glaucoma. Acupuncture can be helpful because we're putting energy into the body. And a skilled acupuncture therapist will treat different meridians in your body to help the overall vision. So I am a big advocate of acupuncture. I think acupuncture can be beneficial. I kind of favor more microcurrent because microcurrent is something that you can do on your own. You know, acupuncture works, but you have to make an appointment with the acupuncture doctor and go maybe once or twice a week. It runs into some expense, and at the same time, it's your time. I like the microcurrent because once you make an investment, this is a treatment that you can do on your own every day to help regenerate your eye. And I do have some, let me share this with you because one of the best ways to find out more information, I'm going to share the screen again, and I'm going to go to my website. Okay, that's healingtheeye.com. All right, let's see here. I'm going to share the screen. Okay, can you see the screen? Can you see my screen? Let me.
Yes, we can see.
All right, great, great. Okay, what you do here is go to new to this website. You see this right here? And click on that. And step one, you become familiar with my approach. You can download my best-selling book right here. If you do have trouble reading, you can click here to listen to the 10 Essentials webinar, which is a kind of a summary of the book. The next step is to find out more about your condition. So if you have cataracts, this is a good video right here, YouTube video. This is one about glaucoma. This is one about macular degeneration, dry eyes, floaters, macular pucker. If it's not on this list, you can go to my podcast station. Next, you can get a free eye record review. You can go to freeconsult.us. I will personally review your eye records. I can't personally speak to you, but I'll give a report to Chris, and Chris will go over the findings with you. You can also find out about my Restore Vision program by clicking here, and that'll take you to all the particulars about the program, how to get started. Then here, this is important. This is to find out common therapies that I use to help reverse vision loss. This is one on microcurrent, homeopathy, ozone treatment, 3 different videos, the ozone eye drops, rectal insufflation, auricular ozone, which is using the ear treatment, one on light therapy, and one on a couple on detox and chelation. So that's probably one of the best ways to get familiar with some of the things that I do recommend. Number one, to become familiar with your problem. Number two is to become familiar with things that you can do on your own. And that's why I would recommend that you do download a copy of my best-selling book, 10 Essentials to Save Your Sight. Okay, there's a question here. Hyperbaric oxygen chamber accelerated my cataract. Is the pressure the problem? I have heard this before, and I think it all depends on the type of hyperbaric treatment that you've had. It could be the pressure, or it could be the oxygen concentration. I used to do the hyperbaric oxygen therapy for my patients routinely, and I've never observed an acceleration of the cataracts. It could be, I think it's unlikely it's related to the hyperbaric oxygen. It could be related to another problem. If I haven't taken a look at your records, Mary, send a copy to the office. Uh-oh, this is one I don't like. I've never been to an eye doctor because I had a bad experience. You need to go to an eye doctor just to get a basic evaluation. And I think you have to find the right eye doctor. Now, you don't necessarily have to go to an ophthalmologist. You can go to an optometrist. You need somebody to take a look at your eyes, because there are some conditions that can lead to blindness very quickly, like glaucoma. And if you have a family history of glaucoma, you need to have that eye evaluation to get a baseline to find out what's going on. So I think you just have to find somebody that you're happy with, and will listen to you and do an eye exam without frightening you. Can eating daily almond yogurt worsen blepharitis? Definitely. I think that dairy in many people is a cause of inflammation, and also people now have an almond and nut allergy. So the answer to that is definitely it could worsen that. And it's always important to listen to your body. Your body knows more what's going on than any eye doctor. So if you are eating certain foods and you do have a worsening of your symptoms, either eye symptoms or physical symptoms, back away from that food. There is something called the elimination diet. I don't want to go into detail with that. You can Google that. The elimination diet is you start with eating low allergy foods and then introducing one food group at a time to try to find out exactly. Here's one, Bethany. Acupuncturist is trained for the eye, and she's also doing microcurrent. And she says, my vision has improved. So great. Yeah, microcurrent and acupuncture can help with vision problems. But you have to make sure you go to a skilled acupuncturist who understands the anatomy of the eye and does the proper treatments. The same thing with microcurrent. There are many microcurrent devices out there. Some of them have a very high current. Some of them have the wrong frequencies. And many of these microcurrent devices will not help. And I would encourage you to maybe take a look at my my video on microcurrent medicine of the future.
I apologize for interrupting, but this is the right time maybe to ask a question.
This Victoria?
Yeah, this is Victoria. I was your patient, and I think you changed the frequency one time, and then you were encouraging to change the frequency another time, but I didn't have a chance to do that. Do I have that possibility? How can someone look at it?
Well, right now we have the ability, and it's wonderful with the modern technology, to change your frequencies online. You would connect your microcurrent device to the computer. I would log onto your computer and I can reprogram your machine. So that eliminates the need for people to send a machine to the office. The first step is I would like to take a look at your records, recent records, to see if you need a change.
Okay, so my records are, I don't even know. I deviated.
No, I need a recent copy. I can't look at old records. I need to know exactly where you are right now. If you send me records 2 years ago, that's not going to help me.
What records would you like to see? The
I would like to have a recent copy of your eye exam.
OCT or visual test?
Well, everything that you could send me, basically with the eye doctor, his comments, you know, your vision, your eye pressure, what's going on with your eyes, the doctor's opinion.
I stopped visiting them because they are pushing me to surgery. And my recent visit was with Dr. Fyodorov in Germany, Berlin. So
well, where do you live? Where do you live now?
I live in LA.
Well, you could see an optometrist, and there is a website of a group of doctors. Let me go back to the screen. Well, you can Google it. It's called the College of Syntonics. These are eye doctors, optometrists that are open to alternative therapies. Many of them do light therapies, and many of them do microcurrent. They're open. And it's the College of Syntonics. But I think you definitely need someone. You need an eye exam, because I really can't treat you without looking at a recent copy of your records.
Okay. All right.
And also, Victoria, you're at the wrong group. This is a group of people who are not involved in my program. You need to go to the more advanced group.
Yeah. Well, maybe I can take a message that I had great improvement with you. And
good.
And I did actually. And I'm missing some products, such as the total ocular function. It's a spray. Do you have those? Can I order or no?
Yeah, you can give the office a call. We have a new product called Ocufolin. I discovered the Ocufolin. It's a medical grade food, and so many of my patients have had a really good improvement of their vision. And the good thing about it, it's very inexpensive. It's only $49.95 a month. Some of my other products that I was using were well over $100 a month. But this is an exceptional product, and it works really well with the microcurrent.
I'm sure it is, but the thing I trusted, I tried. I will go with that. Just the ocular function, total ocular function. Yeah.
Yes.
Also, my last question: if I cannot, my ozone leaked out the oxygen tank. I forgot to close it, and it leaked. How can I get the? I don't know. I don't think you will give me another prescription.
No. You live in California, right?
Yes.
Okay, California is one of the most regulated states in the union. I was in Palo Alto last year. I went into the medical supply store and I got a tank of oxygen. They didn't ask me for my driver's license, no medical license, nothing. You don't need medical grade oxygen. You can get industrial oxygen, and you can buy that at.
Will industrial be okay for that?
What was the question?
Industrial oxygen will substitute.
Industrial oxygen is the same purity as medical grade oxygen.
Oh, okay. That makes it easier.
Makes it very easy. And many of my patients just go to, there's a company called Airgas, AIRGAS. And you can get a tank of, industrial oxygen, and it'll hook up to your microcurrent, or not your microcurrent, your ozone machine. And that's what I use. That's what I use. I use the industrial.
Okay, all right.
But
Thank
if
you
you
very
do, but if you do need a prescription, just give the office a call and we'll send you one.
Do you promise?
Of
I will
course,
be
I promise.
I will be really grateful, doctor, because I'm just trying to stay away from industrial, and then I'm just because you prescribed Keyzone, and it's a great thing, chelation and ozone after, and
Mhm.
instead of injections, I was getting insufflations.
Mhm.
So, and probably after this conversation, the new patients may also think, what is that? And these are like great, great, great procedures.
Yeah,
that
that's a combination of chelation and ozone. But let me make a comment. Anytime I write a prescription for medical ozone, patients have more trouble. They go to the medical supply store and the person there wants to know, what are you going to use it for? What's your flow rate?
No questions were for me, absolutely. When I tried to refill, I said, this is my old one. They looked at it, it's old, but just bring whatever, as long as you have something from any
Mhm.
doctor. But if I go to any doctor, they don't know what the doctors will ask me, what is this? What are you using for? But you know that what is it for? Well, thank you very much. So I will contact the office, email just, or what? Email?
Okay, nice to hear from you, Victoria.
Okay, thank you very much. Thank you.
Okay, bye. The question is, where is the link for the resources in the healingtheeye.com? Okay, let me go back to share screen. Okay. So you go to healingtheeye.com. Can you see the screen? And click here, new to this site. Go to healingtheeye.com, all one word, healingtheeye.com. This, you can click this and you can download my book. This is the highlights of our vision event, which we do every year, but right here, click here, new to our site. And then all the resources are on this page. If for some reason you can't find this page, I'll put this in the chat here. Let me send this to everyone in the meeting. Okay, this is the link. You'll see that in the chat. Oh, good question here. Do you have a list of doctors you can recommend that do alternative eye care in Ohio? I used to know a wonderful doctor, Dr. Terry Chappell, but unfortunately he retired. He was such a wonderful man in Beaufort. I think he was in Beaufort, Ohio. I went to his office a couple of times. One of the best ways to find out is go to a website, www.acam.org. acam.org. And you can type in your zip code and it'll give you a list of doctors that do alternative treatments. Could zirconia dental implants interfere with your eye health? Definitely. There's a joke that dentists will say, if you have eye problems, you should first visit your dentist. There are many situations because every tooth has an acupuncture meridian. And sometimes if you have a cavitation, infection, toxic material in your mouth, it can definitely interfere with your vision. So I would try to find a good integrative dentist or holistic dentist, and they are available. Just Google holistic dentist and talk to them about that. Can a high dose of melatonin cause eye problems? It depends how high you're talking about. You know, anything in a high dose potentially can be toxic to your body. And just to comment, I do think that it is important that you get a good night's sleep for the eyes to regenerate. Sometimes people that have insomnia, sleeplessness. There was a really good study done. It was a Chinese study done that showed that people with macular degeneration who have a good night's sleep in a totally dark room had improvement of their macular degeneration. Because you do need, there's something called their circadian rhythm, where you have to avoid light at night. And this study showed that even the illumination of your alarm clock can cause a suppression of the pineal and interfere with your circadian rhythm. So it is important that you get a good night's sleep in a totally dark room. If you go to my podcast, I interviewed a brilliant researcher by the name of Professor Abraham Hayam, and he studied a condition called light at night, that we're receiving a lot of light toxicity now because of unwanted blue light at night, especially with compact fluorescent blue lights. And his study showed that unwanted blue light at night is a factor for obesity, diabetes, cancer, macular degeneration, and many, many problems. You have to avoid blue light at night. We need blue light during the day. That's why God made the sky blue and the ocean blue. We need blue light during the day, but at night, when the sun sets, it shifts to the red spectrum. We need the red spectrum at night. And many of you have an iPhone, or sometimes they have a night shift. On my iPhone, there's a night shift. In the evening, it goes from a blue tone background to a red background, a night shift. So those of you with eye problems, I think that you really got to look at the circadian rhythm and how you're sleeping. And you can go to my podcast. You can search Abraham Hayam and listen to the report. It's a shame here in the UK that there's very little alternative treatment for eye problems. Well, that's not true. I know a couple great homeopaths in the UK. And if you email me, I'd be happy to refer you to them. And also, I do work with a lot of patients all over the world. And if you are in the UK, send me a copy of your records, and there's no charge for this. I'll take a look at your eye records and make some recommendations specifically for you. And now that we have our home program where we're doing it on the internet, I'm able to treat people all over the world with my program. So don't give up. Hopefully, I'll be able to locate a good homeopathic doctor for you. 100 milligrams of melatonin at night, that's much too high. I recommend 3 milligrams. 100 milligrams could be toxic. Okay, what about wearing blue light glasses before going to sleep after sundown? Blue blockers at night will be beneficial. I don't recommend blue blockers during the day because you need blue light during the day. Isn't it okay to have the night light on but wear a black? No. Oh, that's a big misconception. Somebody said it's okay to wear a black eye mask. Well, even the light hitting your skin, you know, the surface of your skin is the largest surface of your neurological body, and light hitting your skin can affect the autonomic nervous system. So no, wearing a dark mask is not enough. You have to be able to sleep in total darkness. If you're unable to sleep in total darkness, that could be a problem that we may have to address maybe with a homeopathic remedy. If you have a fear of sleeping in the dark, that is not healthy. There's something wrong. Okay. Oh, here's a good question. Does any part of your program address witnessing or experience traumatic events and how it affects vision? Well, as a homeopathic doctor, I really look at the onset of your vision problems, and especially if the onset is related to something emotional, traumatic, or physical. We have certain homeopathic remedies, and we do have certain treatment parameters that can be based on the etiology. I do believe that many eye problems first begin with an emotional or traumatic event. And in the practice of homeopathy, we look at that. I like homeopathy because homeopathy treats the person. So in other words, we just don't look at you or your cataracts. We look at you as an individual as to what might be the cause of the cataracts. Maybe it's heavy metal poisoning, maybe it's your diet, maybe your nutrition, stress. One comment I would like to make is that I think that there isn't any disease that will cure or reverse itself if your body is not in balance. If your body is in a sympathetic state or a fear state or anxiety state, your body has a hard time healing. And unfortunately, a lot of medical doctors put you in that sympathetic or fear state. If you don't take your eye drops, you're going to go blind. If you don't have surgery, I don't want to see you again. And that can be a problem. They're putting you into a sympathetic state. And one of the first steps that you need to do is to begin to develop techniques to relax the body, take you out of that sympathetic state. And of course, there's many, many methods of doing that. Deep breathing, positive affirmations, prayer, surrounding yourself with positive individuals. I describe certain people as emotional vampires. And these are people that when you meet them and talk to them, they're sucking your energy. All they do is start complaining and telling you about all their problems. You can feel the energy being drained from you. You have to avoid people like that. I think many of you have heard that you want your body to be in an alkaline state. An alkaline state is when you have electrons and energy in your body. When you have these emotional vampires, they're taking electrical current from you. And of course, that's one of the reasons why I like the microcurrent. It's very easy to use at home. And microcurrent is not just for your eye. It can be for many, many different parts of your body. I was visiting my wife's friend in Canada. We were here this past week in Montreal. And she's a nurse and she has severe shoulder pain. And she's been going to the acupuncturist and nothing's been helping, but she's in agony. She said the acupuncture helped a couple of times, but now it doesn't help anymore. I had my microcurrent machine. I did one treatment on her and she loved it. She said, I want to buy the machine. It's the first time she didn't have any pain. And it was miraculous. So I made a believer out of her, and she never heard of microcurrent. So those of you that haven't heard of microcurrent or it's new to you, go to my website and view that webinar on microcurrent medicine of the future. So microcurrent is very easy to use at home, very easy to use at home. And it's not just for your eye. It can be for musculoskeletal problems, headache, digestion, arthritis, osteoarthritis, etc. Another question here, what is the optimal red light frequency for cataracts? Well, I think it all depends on the type of cataracts you have. I practice syntonic light therapy. And usually with syntonic light therapy, we use like a lemon color. The lemon is very good for detoxifying the eye. And I think for the cataracts, that's what we want to do. We want to detoxify the eye. And also we want to put some energy in to reduce the inflammation and to cause some healing with that. Let's see here. Once again, if you do have any questions, I'm looking at the chat here. Let's see. If I haven't answered your question, we have a lot of questions here. Maybe retype it in the question mark, or I'd much rather talk to you than just read your question. So raise your hand, put your video on and raise your hand. All right, Barbara. You have to unmute yourself.
Unmute. Can you hear me?
Yep, I hear you. Thanks for raising your hand. I want to talk to people.
I was trying to figure that out, how to do that, because I couldn't type it. I had, oh God, it's 50 years ago, maybe 40 years ago. I had tear plugs put in my eyes, blocking the tear ducts. And in one eye, they put it in 3 times, 2 or 3 times, because it kept going through or something. So I've got a whole lot of plastic down in my sinuses and in my nasal. It blocks my breathing. That makes any sense. At least.
Yeah, it does make sense.
And so, and I still suffer from dry eye. But I'm having all kinds of problems with blepharitis, all the infection coming out of my eyes.
Well, if I were you, I would definitely consider the ozone eye drops.
Yes.
That's probably the most inexpensive approach. Investing, you can buy an ozone generator for around $100 and make your own ozone eye drops. And I have many patients who experienced a miracle. If the ozone eye drops don't work, then I would recommend you invest in a microcurrent machine. The microcurrent will reduce the inflammation, treat that infection, help rejuvenate the eyes. But probably the most practical thing you can do is to invest in the ozone eye drops. And I have a YouTube video on how to make your own ozone eye drops. And I think you're going to be really happy with them.
Funny thing, you should mention dental, because I'm also sitting on about 4 root canals.
Yeah, well, that can run into a lot of money when you start getting those root canals removed.
Well, it's like
you almost have to win the lottery to.
Well, I just want the tooth pulled, because that's what's sending the stuff. So anyway, it's yeah. I just talked to a dental lady yesterday and told her eyes trump teeth. So
yeah. Well, investigate the ozone. I think you'll be really happy with that. And if it helps, get back to us at our next meeting, because we have these meetings once a month. Ask Dr. Kondrot a question, and
I'm thinking seriously about doing your whole program. I'm thinking, and I have a scalar laser.
Yeah, it's a type of microcurrent device, and it can help in some situations, but I like the frequency.
It's not the same as the microcurrent, what you're saying.
No, it's a little bit different.
Okay.
Mine is frequency specific, and it's more geared for treating physical problems in the eye. I would listen to my lecture on the microcurrent. I think you'll find it really interesting.
Okay. Anything else?
Oh, the last question, and we have to close the meeting. Yes. Do I sell the ozone eye drops on my website? No, unfortunately, you have to make your own, because the half-life in ozone in saline is only 2 hours. I can't sell them. By the time I got to you, the ozone would be gone. It's a
Okay.
minimal investment. You buy an ozone generator for under $100. You bubble saline and you use those eye drops. It's wonderful. It's wonderful.
Okay.
Okay, I want to thank everybody for joining this meeting. I will send you a recording, and also I'm going to be sending you a copy of the video on the missions in Africa. I think you'll find it very, very moving, and I hope all of you will support me in my mission work. It's been 2 years since I've done any mission work, and my wife and I decided we miss it so much. We had a great opportunity. Was invited to be the medical director of site.org. So we're heading to Africa in October. So blessings to everybody. Thank you.